Script: Understanding and Treating Heart Disease in the USA. Intro: Hello everyone, and welcome. Today, we're going to talk about heart disease, a condition that affects millions of Americans every year. Heart disease is the leading cause of death in the United States. But the good news is that many forms of heart disease are preventable and treatable. Understanding this disease, its risk factors, symptoms, and treatment options can help save lives. So, let's dive right in. What is heart disease? Heart disease is a broad term that covers several heart-related conditions, including coronary artery disease, heart attacks, arrhythmias, and heart failure. The most common type is coronary artery disease, which happens when the arteries that supply blood to your heart muscle become narrowed or blocked by plaque buildup. This restricts blood flow and can cause chest pain, shortness of breath, or even heart attacks. Risk factors: there are several risk factors that increase the likelihood of developing heart disease. Some you can't control, like your age, family history, and gender. Men, for example, are generally at higher risk earlier in life compared to women. However, many risk factors are lifestyle-related and can be managed or changed. These include high blood pressure, high cholesterol, smoking, diabetes, obesity, physical inactivity, poor diet, excessive alcohol consumption, chronic stress. By addressing these factors, you can significantly reduce your risk of developing heart disease. Symptoms to watch for heart disease can sometimes be silent, showing no symptoms until a major event like a heart attack occurs. However, some common signs include chest pain or discomfort, often described as pressure or squeezing, shortness of breath, pain or discomfort in other areas, like arms, neck, jaw, or back, fatigue, irregular heartbeat or palpitations, swelling in the legs or abdomen. If you or someone you know experiences these symptoms, it's critical to seek medical attention immediately. Diagnosis: doctors use a variety of tests to diagnose heart disease, including blood tests to check cholesterol and markers of heart damage, electrocardiogram (ECG or EKG) to assess heart rhythm, stress tests to monitor heart function during exercise, echocardiogram to visualize heart structure and function, cardiac catheterization or angiography to look for blockages in coronary arteries. Early diagnosis is key to preventing complications and improving treatment outcomes. Treatment options: treating heart disease depends on its type and severity, but there are several well-established methods available in the U.S. healthcare system. Lifestyle changes: adopting a heart-healthy diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, regular physical activity, at least 150 minutes of moderate exercise per week, quitting smoking and avoiding secondhand smoke, managing stress through relaxation techniques, therapy, or support groups, maintaining a healthy weight, medications. Doctors may prescribe medications to help control risk factors and improve heart function, such as statins to lower cholesterol, blood pressure medications like ACE inhibitors or beta, blood thinners, anticoagulants to prevent clots, medications for diabetes management, medical procedures and surgery. In more severe cases, procedures may be necessary, including angioplasty and stent placement to open blocked arteries, coronary artery bypass grafting (CABG) to improve blood flow, pacemaker or defibrillator implantation for arrhythmias, heart valve repair or replacement. Preventive care and monitoring: regular checkups with your healthcare provider are essential for monitoring heart health, especially if you have risk factors. Routine screenings for blood pressure, cholesterol, and blood sugar levels help catch problems early. Your doctor may also recommend lifestyle counseling or cardiac rehabilitation programs. The role of technology and innovation: the United States is at the forefront of medical research and technology for heart disease. Innovations like minimally invasive surgeries, advanced imaging techniques, and personalized medicine are improving outcomes and quality of life for patients. Telemedicine is also helping patients stay connected with their healthcare team from home, which is especially helpful during times like the COVID-19 pandemic. Living with heart disease: a diagnosis of heart disease can be overwhelming, but many people live long, fulfilling lives with proper management. Support from family, friends, and healthcare providers plays a big role in this journey. Joining support groups or counseling services can help manage the emotional and mental aspects of living with a chronic illness. Conclusion: heart disease remains a serious health challenge in the USA, but the power to prevent and treat and layout instructions. Let me know.